Okay, good morning, ladies and gentlemen, and welcome to this week's Let's Talk Dairy. So I spend a lot of time talking about targets and objectives that we set for you to achieve as farmers, and none of it can be achieved if you're obviously incapacitated or anything happens to you in terms of your health. So today I'm joined by Dr. John McNamara, who's the one of the Teagasc Health and Safety Specialists. And John is going to talk to us about, firstly, general health in farmers. I suppose, John, as I was saying to you there earlier, I would associate you quite strongly with the demonstrations in relation to PTO safety down through the years at various Teagasc events and so forth. And I suppose, and I would expect many people, other people would recognise you from that point of view as well. And we've been quite successful, I suppose, in terms of changing the dial, as they say on the radio, in relation to that. And PTO safety has improved quite dramatically. And you're moving on into other areas now. We're not forgetting about the PTOs, obviously, but farmer health is a key issue. And I suppose, again, just timing is everything, as I was saying to there a while ago as well. And I was just talking to Padraig O'Connor there in the last day or two as well. And Padraig's doing milking courses there at the moment. And he's talking about repetitive strain injury with people not changing hands when milking, and maybe on rotary parlours with a lot of cows going through, picking up musculoskeletal issues, we'll say, which give them problems. So, as I said, we're going to just give a brief synopsis of, I suppose, general farmer health and encourage people to look after their own health. And then we're going to focus a little bit more in relation to respiratory health, which people wouldn't probably think is a major issue for them, but and maybe it isn't, to, I suppose, to a certain extent, with the move away from hay down through the years. But there is still a risk there, and we just want to make people aware of that. So John, in terms of general health for farmers, you've some studies done there in relation to discussion groups and so forth. What do the statistics tell us about general farmer health?
No, thanks, Stuart. Thanks for having me on. Yes, no, health is wealth is the first point I'd make. You know, if you haven't health, you don't have anything else really, you know. And maybe a strong point I'd make at the start is that maybe in the long term, 70% of illness is preventable, you know, and that so we can make changes. Now, there was a major study done by Dr. Breda Smith, you know, a very person in Ireland who is now the acting chief medical officer. And it found that farmers had 5 times higher cardiovascular disease, 3 times higher cancers, and 3 times higher injuries than other comparable people, like blue collar workers, professional workers. So that set our alarm bells off back maybe 12 years ago. So we started promoting health, personal health, particularly strongly. And personal health is related to getting a health checkup and knowing what your health status is, diet and exercise and that sort of thing. Now, moving on to occupational health, as you mentioned, like the big risk areas are musculoskeletal disorders. And we've done, Dr. Aoife Osborne did a PhD with us, and we've a lot of research done in that area. And that is a big occupational issue. The other one would be respiratory disease. And thank you, it's something we are not asked about a lot, but is a silent issue. And then there's, infections and, health issues from livestock and Weil's disease, that sort of thing. And the last thing I might mention briefly, I just mentioned it, is, occupational stress, which is related to the way we farm, but also to personal issues. Okay. So that's the broad canvas of the area.
So just, I suppose, before we go into the respiratory stuff, like in terms of the musculoskeletal, what are the main issues there, John?
Well, no, the main, 50% of farmers have musculoskeletal at any stage in their lives. The simple thing is don't lift. We can cut out lifting. We can put wheels on the gates. We can use sliding doors, and don't be bursting your back and the rest of your body wearing it out, and that. And I think that's the key message. But, lift properly if you have to lift, keep, a good stance, wide boxer stance, and keep your back relatively straight and lift with your thighs.
Okay. And then just, I suppose it's important to point out again, just as we were talking before we came on air there in relation to the cancers, we'll say, you said cancers was a high issue as well. Which one of the cancers is the main cancer from that study that Breed Smith did?
No, well, in her study, it was just cancers, right? But a topical one there at the moment, I have a can of it here beside me, is the sun, I'm just looking at a study we did, Dr. Tracy O'Connor did with discussion groups a few years ago, and there was particularly low uptake of among discussion groups about discussing, sun protection. So that is a crucial one. Now, the other big one would be related to diet and exercise, gastrointestinal cancers and that sort of area, and it's related to lifestyle. And, respiratory issues also are related to being overweight and diet and lifestyle also.
Okay. So I'll just play the video here and we'll come back to the situation then in terms of discussing the respiratory health. Oh, I need to optimize sound here now first.
Dust spores and vapors can cause very severe illness. It is important to reduce dust and spores. Always wear the proper PPE, for example, masks, and improve ventilation. Long-term effects include asthma, chronic bronchitis, shortness of breath, weight loss, farmer's lung, and sensitization.
So, John, I suppose some people that might be tuned in this morning may have concerns, I suppose, around their respiratory health, maybe possibly following a COVID infection and so forth. And obviously some people will have been affected by that. So they may have a greater awareness than others. But like, as I said, we've moved away from hay to a large extent, obviously, for whole-scale animal feeding, but it's still around, and obviously silage itself can have mold as well. So the concerns around that for people and what people should be conscious of.
Yeah, no. The first thing I would say very briefly is, if people have concerns about their health, they should contact their medical doctor. There are treatments available, and the earlier one gets them, the better. Now, the second point I'd say, just related to that video, you saw a bale being opened, and you saw those grey-blue spores coming off. And that is public enemy. Those spores are public enemy number one as regards respiratory health. They contain proteins, and if you get a high dose of those into your lungs, it'll cause respiratory sensitization and scarring and that sort of area. And one high dose can trigger an allergy or a condition that is then triggered by subsequent very low doses thereafter. Now, it's not just bales, silage, grain, any type of feed or mold going with it and that. So basically what the lungs need is clear air and nothing else. And our problem in Ireland is our 3 or our 4 or 5 month winter, when we're indoors and we're feeding feeds by and large, and we have the potential to have those spores there. Now, one very important message there in the video was ventilation, and that should always come first. Good ventilation, airflow for livestock, as well as for people, is absolutely crucial to lower the levels in the first instance.
Okay, so John, just to expand a little bit, I suppose, on that sensitization piece there, just so that people are clear on it. So if I were to open a bale of hay that was moldy today and those spores fly up basically, and I inhale a lot of them, you're saying that's going to basically trigger a response in my lungs, and it won't take as much of a dose the next time to actually trigger that response. So I could basically get a chronic issue from that one big inhalation of that dust spores.
Basically, that's absolutely correct. It's the proteins in the spores cause an inflammatory reaction or a sensitization, And, that leads to lung damage, and it leads to, asthma and other conditions as well. And as I said, once the lungs have identified the spore, they pick it up subsequently in small doses, and then the body reacts to the spores and, causes the problem.
So in essence, it's nearly like a vaccination in reverse almost. Like, so it recognizes this spore again and reacts to it and creates say maybe the asthma or the bronchitis kind of scenario possibly, or whatever, or the increased level of coughing.
No, yes, absolutely. That is a good analogy.
Yeah, so I suppose in terms of prevention of it, I suppose, like, again, talking about it in the last couple of days, which the idea of wearing the masks and so forth is probably, it's a bit of a challenge for people. But what would your advice be in relation to avoid this? Now, obviously, the ventilation is ventilation is your first protocol. But if that's not an easy solution to come by, what would you be recommending?
No, just in case, could I just briefly mention the figures? And there have been 3 or 4 very good studies done in recent years by research teams in NUIG and also in UCC. But what they found basically in summary is that 60% of farmers have some sort of a respiratory issue, and hay fever and that sort of thing would be a big issue. Right. Now, 13% of farmers have an airways disease, and 12% have some form of lung damage measured by what's called the spirometer. So those figures are high, right? That is the crucial thing. And I think in a study among dairy farmers, I think 7.5% of the farmers in the study were on medication for respiratory problems. So the point being that there is a problem out there. Yeah, no. To come back to prevention then, which is what we in Teagasc are doing. Ventilation, as you said, is the first issue. Now, the second issue, and it's not to do with it's personal rather than farming, but smoking. Smoking is incredibly bad for all sorts of things. Now, the good news is that farmers smoke less than the rest of the population, and that levels are dropping. And that now, in research we did in our cardiovascular study, Farmers of Hearts, we included smoking cessation by referring people to www.quit.ie, and that was pretty effective. I think the reduction in the level of smoking was about 30% over 1 year, which is very positive. But it also shows that it can be done. We can make changes, and the overall study showed that farmers could make changes. Now that brings me on to the mask, and the mask it became very popular during COVID. And by the way, this mask is a different mask to the COVID mask. The COVID mask is just kind of woven canvas. This is a P2 mask, and that is very finely designed and engineered to keep out tiny spores, right? So it's it's a question of the first thing is eliminate. If you see a bad bale or if you see moldy hay, just get away from it, get rid of it, out of there. No, but we should be wearing this mask more frequently, around the farm and that. Now, it's a hard sell, and it's, it goes against the grain of health and safety. We prefer to take the danger away from the person rather than have people wearing a mask, because we know it's awkward and that, but in this case of respiratory conditions, I can see, it is a crucial piece of protection. And it's particularly the case if somebody has a respiratory condition, that they wear this mask.
So would that include being a smoker, John?
Oh, absolutely, yes, yeah. And I sympathise with smokers, and and that, I know it's not easy to give it up, but it is important. Yeah, no, but yes, the mask will keep out spores from the from the lungs, and it will be helpful. Okay,
and I suppose The main issue that I would see then, John, as well, I would say, is liming cubicles and dusting cubicles and so forth for dairy farmers in particular. Like, there's obviously differences between masks, because there are masks. People often don't wear masks, or they start wearing a mask and then they take it off because they're finding it maybe actually difficult to breathe with it on, possibly, or they kind of, do you know the angle I'm coming from there? So, like, is there actually, like, that FP2 mask is a comfortable mask to wear and actually works well from the point of view of breathing while working, possibly, like?
Yeah, no, you're right. Like that, liming cubicles is an issue as well, and inorganic dust, including lime dust, would be an irritant to the lungs, so should be avoided. Now I would think that is a larger particle, maybe, and that even the ordinary mask might do for that. These masks, these P2 masks, are very finely engineered, and they have a much tighter weave to keep out the very tiny spores. Now, while you're talking, it's like the mask is the last line of defense. So it's really important to wear it properly. That it's properly put on, and that it's the seal around the face is very tight, and that. So as a consequence, like, it can be a little bit awkward, and as a result, people might find that it's not that comfortable. No, having said that, I think, I've seen it. I've shopped around myself in various co-ops, and I'm glad to say that they're pretty readily available. And shop for a mask that suits you and fits you best, and that you're comfortable with.
Okay, and I suppose the other thing, John, as well, to point out to people is, like, you can kind of get used to a lot of things, and even coming back to Padraig O'Connor talking about the switching hands when milking and so forth. It's a very difficult trait to break if you're doing it wrong, but it can take 3 or 4 weeks to break it, maybe, but you actually can change it. So I suppose the point I'm trying to make there is, in the video you mentioned the proper PPE, and there's a person putting on the glove there. Like, gloves were completely alien to farmers many years ago, with the exception of the few that might have worn a pair of milking gloves when they were milking. Now it's nearly the opposite way around. The exception is almost the person that doesn't wear gloves when they're milking. And, like, face masks, we need to try to actually switch that narrative, I suppose, or change that mindset around them too, do we?
Yeah, no, I totally agree. Like, this glove that I have here, like, it costs €1 or less, but it's a fantastic piece of equipment. The same with a mask, and I think, dare I say it, COVID taught us all to wear masks at a very fast pace, and that. So maybe we should build on that. But the health and safety professionals wouldn't just emphasize the mask alone. We would emphasize elimination, getting rid of the hazard. That bad bale that we opened there, that was dumped forthwith. Make sure, if you see moldy hay, realize that it's bad for your lungs, and get rid of it, or moldy anything, and that. No, but you're right. Behavior change is difficult, and it takes time, but it can be done with a little bit of determination. Now, the challenge with farmers is, like, that they're all individual, and they don't, broadly speaking, that that they wouldn't be in this contact with other people as, say, in a factory or an industrial site. No, but the get out of clause there, though, is our discussion groups and our meetings and that. And I think we in Teagasc, we should be highlighting these issues more, and bring them to farmers, and that emphasises this. And like you said with the gloves, it then becomes kind of part of the way of doing things, and it becomes it becomes adopted. And I'm glad to say, in the study that we did with Dr. Tracy O'Connor, 37% of discussion groups had discussed respiratory hazards in the past year. So I'd say to people in discussion groups or organising discussion groups, so to put health on the issue, we have an abundance of leaflets and booklets and information sources, but the challenge of adoption is for people to interact with other people, and to see the importance of change, and to to close the deal, as it were,
Okay, so John, and just this final piece, I suppose, on the respiratory, just chemical safety is a risk. Obviously, dairy farmers handling chemicals for washing machines and washing parlours and maybe disinfecting houses for all livestock farmers. Risks around that?
Yeah, no, well, all the chemicals are different, and some of them are respiratory sensitizers. They'll be rare enough, but they can cause an allergic reaction. So read the label, know how to apply the equipment, use enclosed systems if possible, and of course, wear the personal protective equipment, PPE, a face mask to cover the eyes, a mask on the face. Now, that would be a different type of mask for chemicals, and gloves, of course, and, whatever clothing, protective clothing to cover your body.
And I suppose dispensers, maybe, rather than trying to pour these chemicals as well, where you're going to be at risk of splashing.
No, absolutely. That that is the biggest risk, the concentrated chemical where you're pouring it. So dispensers and using equipment like that, you have to cut down the risk.
Okay, so just, I suppose it's not respiratory, but just you said there that one of the just before we came online there as well, that one of the biggest issues at the moment is people getting knocked down. So I think it's worth pointing it out, even though it's slightly off the topic that we said we were going to talk about today, just to remind people and to make people that are tuning in conscious of it.
No, thanks. Can I mention lime first? No, lime, hydrated lime, if it gets into your eyes, can cause blindness. So wear goggles, when you're, and I've heard quite a number of cases recently about this, and I made a video 30 years ago with an ophthalmic surgeon about this. That's the first point. Yeah, I'm glad that we've made progress with power shafts. We haven't solved it. I saw an uncovered power shaft passing me by on the road yesterday, but fatalities have dropped, but we can never say never. The big challenge now is big tractors in farms, in small farmyards, in relative terms, and speed around the farmyard, 5 or 6 kilometers an hour even. Tractors are moving at maybe 2 meters a second. A bystander steps out, a child maybe, or an older farmer, and knockdowns occur on, and there's blind spots. The driver can't see everything, and that. So the key message is to look out for blind spots, and not have younger or older or people around the farmyard where there's machinery moving, and simply to slow down, because that reduces the risk.
Okay, so that's super, John. Thanks very much for coming on and for talking about it. And I hope people will have taken something from it. I suppose the one thing I always think is, if you were advertising for a person to be a farmer, you'd be asking for somebody that was able to manage stock, manage grass. They also have to look after the health and safety element of their farm. They have to look after the hours, the rosters. Farmers actually have an awful lot to deal with. And as you said, while they may be conscious of the health and safety, it can be a little bit down the pecking order. But we need to try to change that mindset, that we kind of think about the way we approach work and what we're doing with a health and safety mindset very much to the fore. So it's good to have you on to talk about it. And as I said to you the other day, rather than doing a broad sweep of health and safety, we'd focus on the respiratory today, and we might come back and talk about some other aspects at another stage during the year or early next year. So that's it for today. Thanks very much, John, for coming on. I'm taking 2 weeks off, so I won't be back next week or the week after, but we'll be back again the week after that. So in the meantime, I wish everybody well, and obviously in light of the subject today, and as I always say, farm safely in the meantime, and we'll talk to you soon. And thanks again, John, for coming on.
Thank you.